Oh,
Good evening and welcome to the New Milford High School James Africano Auditorium. Thank you for joining us and for tuning into this very special event. And thank you for the patience that you have shown with the change and the last minute changes in the scheduling. My name is Lisa Natal and I am the District Coordinator of Nursing Services here in the New Milford School District. I am joined tonight with many distinguished guests who are here to bring a wealth of information to you regarding the coronavirus. My first guest here is Shireen Bakhtiar. She's a certified health education specialist with Hackensack University Medical Center. I'm also joined with Ms. Lori Palmer, who is the New Milford Department of Health Community Health Nurse. I am also joined by Denise Bruner, who's the Director of the Office of Emergency Management, the President of the New Milford Board of Health, and is also presides as the President of the New Milford Ambulance Corps. I'm also joined by Bill Drew, who is the Deputy Director of the Office of Emergency Management. So once again, thank you. I'm going to turn the time over to Mrs. Bakhtiar, and we will tune back in later for more commentation.
Thank you very much, Lisa. Hi everyone, my name is Shireen Bakhtiar and I'm a health educator at the Health Awareness Regional Program of Hackensack University Medical Center. I'm here to share some information that you should know about the current outbreak of COVID-19. So, coronavirus disease of 2019 is a coronavirus, which is a common family of viruses, just like influenza is a common family of viruses. These viruses circulate seasonally every year, much like colds and flus do, and they are also numbered. They are a common cause of cold, and most of us have been infected with a coronavirus at some point in our lives. Many of us have been to the doctor, and we've heard the doctor say, I think your symptoms are most likely caused by a virus. We aren't tested for every single type of virus out there, so it could have been a coronavirus. So all the fuss about COVID-19 is that it's a disease caused by a novel coronavirus. Novel means new. Coronaviruses begin in animal populations, and sometimes they start causing infections in humans, which is what we're seeing now. The coronavirus of 2019 began infecting humans in Wuhan, China last December. A new virus is always a public health concern because it can be unpredictable since humans are not immune. So how well the virus spreads and the severity of the disease it causes are unknown at the beginning of each outbreak and may even change during the course of the outbreak. The CDC, Centers for Disease Prevention, watch new coronaviruses very closely and gather lots of data about how they behave in human populations. Two recent outbreaks of novel coronavirus have been SARS, the Severe Acute Respiratory Syndrome of 2003, and more recently MERS, the Middle East Respiratory Syndrome, which was identified in humans in 2012. So a lot of people are wondering about their risk, and that's actually one of the top questions that public health call centers are receiving. It's important to know that some people are at higher risk than others. This risk varies by population, and at this time, the virus is currently spreading in some communities of the U.S. Enhanced public health screenings implemented by the CDC and U.S. Customs and Border Protection help to detect new cases and prevent further spread. Again, the goal of an ongoing U.S. public health response is to detect new cases quickly and prevent further cases from spreading. Isolation and quarantine help protect the public by preventing exposure to people who have or may have a contagious disease. Isolation separates sick people with a contagious disease from people who are not yet sick. And quarantining separates and restricts the movement of people who are or have been exposed to contagious disease to see if they become sick. People who have been determined to have at least some risk for being infected with the virus that causes COVID-19 are actively monitored or may be asked to complete passive monitoring. Active monitoring means that the state or local public health authorities assume responsibility for establishing regular communication with potentially exposed people to assess their presence of symptoms. Whereas passive monitoring means people monitor themselves, and anyone on self-monitoring should be provided a plan for whom to contact if they develop symptoms during the self-monitoring period. So let's take a moment to put your risk into perspective. Every year, the flu, influenza, causes millions of cases of illness. In 2017 to 2018 flu season alone, the estimated number of illnesses due to flu was about 45 million. The number of deaths was over 61,000, with 633 deaths in children under the age of 18. Flu severity is unpredictable, and even healthy people can become seriously ill from the flu. In general, the flu does not cause a lot of concern because it has become familiar and an expected part of the year. Yet, the first few cases of COVID-19 in the US caused great amounts of concern, even though most of the people who have been infected recovered on their own. And this is largely because diseases that are unfamiliar to us create a greater perception of risk than diseases we are familiar with. So for most people who become infected with the virus that causes COVID-19, they experience symptoms much like other respiratory illnesses, with fever, cough, and even shortness of breath. These symptoms can range from mild to severe, and of the people who have had severe illnesses and have died, they were older adults and those with other underlying health conditions. At the present time, there is no vaccine to prevent coronaviruses approved for general use, and there is no specific treatment for coronavirus other than easing the symptoms in those who have had mild illness to make them more comfortable, such as decongestants, cough suppressants, and maybe even fever-reducing medications. More serious cases of coronavirus disease of 2019 may require supportive care in hospitals, depending on the patient's severity of pneumonia or his or her difficulty breathing. Coronavirus is spread from person to person, much like other respiratory illness does, and when people cough or sneeze without covering their mouth and nose, the virus sprays out. We can also become infected by touching an object or surface that has the virus on it, and then by touching our eyes, nose, or mouth with unwashed hands. People who are in close contact with an infected person are also at risk of becoming infected, and healthcare workers need to wear protective gear to prevent exposure while caring for infected patients and during medical testing procedures that put them at greater risk of exposure. When we talk about incubation periods, it refers to the time from when a person exposed to the virus to the time that they develop symptoms. For COVID-19, the incubation period seems to be approximately 2 to 14 days, meaning that people become sick anywhere from 2 to 14 days after coming in contact with that virus. A lot of people, especially on social media, have been saying that this virus is spreading before people develop symptoms. There have been reports indicating that the virus may have spread before symptoms developed. However, that is not the main way that virus spreads. People are most contagious when they are most symptomatic. And according to the CDC, outbreaks are not driven by pre-symptomatic spread. As with any new virus, there is still much that the CDC does not know, and they are working diligently to collect and analyze data to learn more, so that they can give the most accurate recommendations and guidelines possible to the local task force. As with most other respiratory illnesses, the same prevention strategies apply. We want to do the basic things like covering our coughs and sneezes with tissues or our sleeves, not our hands. We don't want to use our hands because the germs we've just sneezed onto our hands get transferred to everything and everyone we touch. When you sneeze into your elbow or your sleeve, be sure to completely cover your mouth and nose with the fabric when you sneeze. Similarly, when using a tissue, make sure you cover your nose and mouth and throw the tissue away once you're done using it. Do not reuse the tissue. We also want to make sure that we're washing our hands often with soap and water for at least 20 seconds, or alternatively, we must use alcohol-based sanitizers when soap and water are not available. If you or someone you know is sick, please stay home and avoid others who are sick. CDC does not currently recommend the use of face masks among the general public. There are many different types of masks that serve many different purposes. Here, the two masks we've outlined are the N95 respirator or a surgical mask. The N95 is a personal protective device that protects the person wearing it. It reduces the risk of infection by inhaling hazardous airborne particles. These devices are certified by the CDC and NIOSH. For the respirator to provide protection, according to the Occupational Safety and Health Administration, it must be fit tested to ensure that you are using the correct make, model, and size to ensure that there's a tight seal against the face. A surgical mask, on the other hand, is a looser fitting mask and does not effectively filter small particles from the air because air leaks out and in around the edges when the person is wearing it. The role of the surgical mask is for sick patients to wear them to prevent contamination to the surrounding area when they cough or sneeze. Patients with confirmed or suspected coronavirus disease of 2019 should wear a surgical mask until they are isolated in a hospital or at home. If you are planning to travel to an unaffected area, the CDC has posted very specific travel restrictions and recommendations on their website. Please check their website to see if the area you plan to travel has a travel advisory. And if you absolutely must travel, please avoid contact with sick people, avoid animals, alive or dead, animal markets, and animal products such as uncooked meat. And as always, be sure to wash your hands frequently. If you recently traveled to the U.S. from an affected area and are feeling sick, please seek medical care right away. However, call before you go to the doctor, urgent care, or hospital. By giving these providing organizations information about your health, you're giving them the opportunity to prepare for your arrival and make arrangements to prevent any possible infection spreading to others in the waiting areas or even to the healthcare workers. Another alternative is to use telemedicine. By using telemedicine, you're avoiding contact with others as much as possible. You should also plan on staying home. If you stay home, try to stay in a private room, suite, or bedroom, especially if you live with others. This is another good opportunity to use grocery delivery systems. Make sure you're covering your coughs and sneezes. And again, wash hands often or use hand sanitizer. The CDC is working closely with the World Health Organization to monitor the situation. They're working with the state and local public health partners as well. As mentioned earlier, they are conducting enhanced entry screening of passengers arriving from China and other high-risk countries at designated airports across the U.S. and they are working to rapidly identify anyone who may be ill. Anyone who is identified as having symptoms and a travel history to affected areas is being monitored very closely and provided with medical care as needed. All of these steps will help to rapidly find and contain the illness here in the U.S. The CDC is providing educational materials to screened passengers with instructions on what to do if they become ill within 14 days after arriving back to the U.S. Here is a photo of a sample of education that these passengers receive. There seems to be some confusion on who should be tested. The CDC has very specific criteria that must be met, including recent travel and respiratory illness symptoms in order to be tested. Healthcare workers or people who had contact with a known lab-confirmed case and have symptoms would also qualify for testing, as well as people who had no known exposure yet still developed severe lower respiratory illness for which there was no alternative explanatory diagnosis such as influenza. There is no testing of the general public needed for people who do not have these symptoms. The New Jersey Department of Health is working with state and federal partner agencies to establish plans and procedures in the event that ill travelers are identified. The New Jersey Department of Health staff is creating guidance documents to help other public health professionals and healthcare providers in investigating and managing suspect cases as well as confirmed cases. And please remember that there's a lot of misinformation out there. Even the news media get the facts wrong sometimes. Try to reach out to .org or .edu organizations. Your best references are the New Jersey Department of Health or the CDC. These credible sources of information will help get the facts to you and avoid any false information. The New Jersey Department of Health, again, is working in conjunction with the New Jersey Poison Information and Education System to operate a public call center for people who still have questions after looking at available resources. The call center is staffed by trained healthcare professionals and is open for calls 24/7. They can accommodate multiple languages. For any further questions or concerns, please do not hesitate to reach out to your local health department. They are equipped with a few answers and will be willing to share as much as they know with our local community.
Thank you, Shireen, for all of that wonderful information that's up to date and the latest information that is available to us. So many people out there are wondering what is going on in the school systems. And here in the New Milford Public School District, we are committed to the health and safety of our students, staff, and community. So rest assured that we are following all of the CDC and Department of Health guidelines and are in contact with the Department of Health multiple times per day. In addition, we will continue to provide you with open communication and information as we receive it. Thank you again, everyone, for being here. And again, if you have any additional questions, reach out to those .edu and .org references that Shireen mentioned, the CDC website, and contact the phone number that she listed in the PowerPoint. Thanks again.